Welcome to our Biomedical Solutions YouTube channel. Here we explain all our biomedical engineering department topics with PPT format. We also have PDF format with simple notes.
Electroencephalography (EEG). Introduction. Electroencephalography (EEG) is a technique used to record the electrical activity of the brain. It is crucial for diagnosing and monitoring neurological conditions such as epilepsy, sleep disorders, and brain injuries. EEG recordings can be made using either unipolar or bipolar configurations. Unipolar EEG. Definition. In unipolar EEG, each electrode records the electrical potential at a specific location on the scalp relative to a common reference electrode. The common reference electrode can be placed at a relatively inactive site such as the earlobe or mastoid process. Configuration. Electrodes are placed according to the International 10-20 system, which ensures consistent and reproducible placement. Each electrode records the potential difference between its site and the common reference point. Advantages. Simplifies the interpretation of EEG by isolating activity at each electrode site. Useful for identifying focal abnormalities such as localized seizures or lesions. Disadvantages. Susceptible to reference noise if the common reference electrode picks up extraneous signals. Reference electrode selection can influence the recorded signal, potentially introducing artifacts. Bipolar EEG. Definition. In bipolar EEG, the potential difference is recorded between two active electrodes placed on the scalp. No common reference point is used, instead, each pair of electrodes forms a differential pair. Configuration. Electrodes are also placed according to the International 10-20 system. Recording is done between pairs of electrodes, typically arranged in longitudinal or transverse montages. Advantages. Reduces the influence of extraneous noise since both electrodes in a pair are affected similarly by common noise sources. Enhances the detection of phase reversals, which are critical for localizing the origin of epileptiform discharges. Disadvantages. More complex interpretation due to the differential nature of recordings. Inter-electrode distance and positioning can affect signal quality and spatial resolution. Clinical applications. Unipolar EEG. Commonly used in routine clinical practice for initial evaluations and monitoring. Bipolar EEG. Often used in detailed diagnostic studies, particularly for epilepsy surgery planning and localization of seizure foci. Electromyography (EMG). Electromyography (EMG) is used to assess the electrical activity produced by skeletal muscles. It is essential for diagnosing neuromuscular disorders, evaluating nerve function, and guiding treatment for various conditions. Unipolar EMG. In unipolar EMG, the electrical potential of a muscle is recorded relative to a common reference electrode. The reference electrode is typically placed on a bony prominence or an electrically neutral site. Configuration. A recording electrode is inserted into or placed on the muscle of interest. The potential difference between the muscle electrode and the reference electrode is measured. Advantages. Simplified setup and interpretation. Useful for detecting generalized muscle activity and assessing overall muscle health. Disadvantages. Susceptible to reference noise and artifacts. Less spatial resolution and detail compared to bipolar recordings. Bipolar EMG. In bipolar EMG, the potential difference between two active electrodes placed on or in the muscle is recorded. No common reference is used, the differential potential between the electrodes is measured. Configuration. Two electrodes are placed along the length of the muscle fiber, typically at a short distance from each other. The differential signal between these electrodes is recorded. Advantages. Reduced noise and artifact susceptibility since both electrodes experience similar extraneous signals. Enhanced spatial resolution, allowing for more detailed analysis of muscle activity and motor unit action potentials. Disadvantages. More complex electrode placement and interpretation. Requires precise positioning to ensure accurate and reliable recordings. Clinical applications. Unipolar EMG. Used for general muscle assessment and initial diagnostics. Bipolar EMG. Preferred for detailed studies, such as motor unit analysis and precise localization of neuromuscular abnormalities. Einthoven's triangle. Einthoven's triangle is a foundational concept in electrocardiography, named after Willem Einthoven, who developed the first practical ECG. It simplifies the understanding of the spatial relationships and electrical potentials recorded by the limb leads. Concept and formation. Einthoven's triangle is an equilateral triangle formed by the placement of electrodes on the right arm Ra, left arm La, and left leg LL. The triangle represents the three standard limb leads of an ECG, lead I, lead 2, and lead 3. Leads and their relationships. Lead I measures the potential difference between the right arm Ra and left arm La. Lead 2 measures the potential difference between the right arm Ra and left leg LL. Lead 3 measures the potential difference between the left arm La and left leg LL. Einthoven's law. Einthoven's law states that the electrical potential of any lead is equal to the sum of the potentials of the other two leads. Lead 2 equals lead I plus lead 3. This relationship ensures the consistency and accuracy of the ECG recordings. Clinical significance. Accuracy check. Einthoven's triangle and Einthoven's law are used to verify the correct placement of electrodes and the accuracy of the ECG machine. Diagnostic utility. The triangle helps in understanding the spatial orientation of the heart's electrical activity, facilitating the diagnosis of arrhythmias, myocardial infarction, and other cardiac conditions. Vector representation. It provides a simple way to visualize and understand the vector nature of the heart's electrical activity. Standard 12-lead system. The standard 12-lead ECG system provides a comprehensive view of the heart's electrical activity from multiple perspectives, enabling detailed analysis and accurate diagnosis of cardiac conditions. Leads in the 12-lead ECG system. The 12-lead ECG consists of 3 bipolar limb leads, 3 augmented unipolar limb leads, and 6 unipolar precordial chest leads. Bipolar limb leads. Lead I measures the potential difference between the right arm Ra and left arm La. Lead 2 measures the potential difference between the right arm Ra and left leg LL. Lead 3 measures the potential difference between the left arm La and left leg LL. Augmented unipolar limb leads. AVR augmented vector right measures the potential difference between the right arm Ra and the central point of LA and LL. AVL augmented vector left measures the potential difference between the left arm La and the central point of Ra and LL. AVF augmented vector foot measures the potential difference between the left leg LL and the central point of Ra and LA. Precordial chest leads. V1 placed at the fourth intercostal space to the right of the sternum. V2 placed at the fourth intercostal space to the left of the sternum. V3 placed midway between V2 and V4. V4 placed at the fifth intercostal space at the midclavicular line. V5 placed level with V4 at the anterior axillary line. V6 placed level with V4 at the mid-axillary line. Clinical significance. The 12-lead ECG provides a detailed and comprehensive analysis of the heart's electrical activity by capturing it from different angles and planes. Diagnosis. Helps diagnose various cardiac conditions such as myocardial infarction, ischemia, arrhythmias, and structural abnormalities. Localization. Each lead offers a unique view, enabling the precise localization of abnormalities in the heart.
Thanks for watching. Subscribe our Biomedical Solutions YouTube channel and comment your opinions.